Well, good evening. It's so good to see you join us tonight. We're hoping a few more folks will come in as well, but we are off to a great start. This is the second in a series of hypertension workshops, and tonight we'll be talking about the use of the self-measurement device at home. And I'll turn it over in just a minute to Paula Rains, who's sitting to my left. I wanted to remind you that these grants are offered with grant support through the Department of Public Health. And we have 6 workshops scheduled that we started a couple weeks ago, and these will continue every other Monday evening at 6:30 through Monday, June 6th. Tonight, like last time, we'll have the workshop recorded. So if any of you need to review the material, or if you have friends who would like to see the workshop, they can certainly access the workshop through the Town of Windsor website. We ask that everyone complete the pre-diabetes screening form that looks like this. If you're at all 6 workshops, I only need you to complete it once and then return it to me. And in addition to that, on the website, the handouts are available and you can download and print those. And in addition to that, there's an evaluation form that can be completed online and then submitted. Once those are all collected, we will be awarding gift cards at the conclusion of the series in June. We will be recording this, and when we go to the question and answer portion of the presentation, we will stop the recording for privacy reasons, but a reminder that that question and answer is really not intended to be any type of personal healthcare consultation. All right, and with that, I'm going to turn it over to you, Paula, and you can take it away.
All right, thank you. You can start the presentation. Okay, so I will just tell you guys a little bit about myself first before we go into the blood pressure monitoring presentation. As she said, my name is Paula Rains. I have been a nurse for about 16 years now. But before I was a nurse, I had my bachelor's degree from a little university in Pennsylvania called Slippery Rock University, where I got my degree in exercise science and psychology. After graduating, I moved here to Connecticut and worked for Aetna in their fitness center for about 4 years as an exercise physiologist. Then I was laid off from there and went back to school for nursing and became an LPN. And after I graduated from nursing school, I worked for a facility, a subacute rehab center in Glastonbury, where I worked there for 8 years on their subacute floor as well as their long-term care floor for about 8 years before moving on to Central Connecticut Cardiologist, where I am currently the head nurse. So I've been there for about the last 8 years and have worked my way up from one of the nurses there to the head nurse in their Enfield office. We have three offices, one in Hartford, one in Simsbury, and one in Enfield. I work in the Enfield office and I am the head nurse at that office. So that's just a little bit of background about myself and why I'm here to do this presentation for you. So let's move on to what home blood pressure monitoring is, why we should do it, and why it's important. So we'll start off with what actually blood pressure is. It's not doing anything. Oh, there we go. Okay, what is blood pressure? So blood pressure, whether you're looking in the Tabor's Medical Dictionary or if you're looking in the Merriam-Webster Dictionary, whichever one you're looking at, the definition for blood pressure is the same. Blood pressure is the force of the blood against your arteries. The more force you have in your arteries, the higher your blood pressure is. Your blood pressure consists of 2 numbers. The top number is your systolic number, and that measures the force of the blood as your heart contracts. And the bottom number is the diastolic number, which is when your heart relaxes and fills back up with blood. So you've hear people say about the boom, boom, boom when you're talking about a heartbeat. So that's the two parts of the blood pressure. When your heart is contracting, that's the top number. When it's pushing the blood out from the ventricles, the bottom part of the heart, it's pushing the left ventricle specifically, is pushing blood from the bottom portion of the left side of the heart all the way through your entire body. And then it comes back up through the top portions, which are your atria, to the top part, goes back down into the ventricles and starts the thing all over again. So when it fills back up into the top portion of the heart is relaxing. That is your diastolic number. That is when your heart's filling back up with that blood to get oxygenated again, and then go back out and go through the body all over again. So that is what your blood pressure is. So the force of the blood against the arteries, that is the definition of what your blood pressure is. So we're going to talk about what number. No, I went too far. Oh, no, I didn't. Okay. What number is the most important one? Both numbers are actually really important. We need to pay attention to both numbers. But from a cardiovascular standpoint, the top number, when the heart is contracting, when it's pumping that blood out to the entire body, that is the one that puts you at greater risk for cardiovascular disease when that number is more elevated. Research has shown that when that number is higher, it puts you at a greater risk for strokes and heart disease. And typically, as we get older, our arteries, they become stiffer, and they also can get clogged with plaque. And so that tends to make that top number build up or increase. So we want to make sure that we're monitoring our blood pressure so that we know if those numbers are getting higher, as they do just normally as we age. Now, I do want to just mention real quick, as we're talking about plaque right here in this tiny little section here, that there is a test that you could probably speak to your doctor about, that I know in my office, the doctors are really highly recommending that their patients get. And it's called a coronary calcium test. And what this does is it looks at the amount of plaque buildup in the coronary arteries. So there's arteries throughout the entire body, but your heart specifically has its own set of coronary arteries, that just feed oxygen specifically to the heart. And this test, it's just an easy ultrasound test. You just go to radiology. It's not invasive or anything like that. But this test will show you how much plaque buildup you have in these arteries. So it is a good indication of if you have coronary artery disease or not. It is not a test that insurances are covering just yet. It is an out-of-pocket cost, but it's about $99. But it's a really good test to give you a whole lot of information to make sure that you are taking care of your arteries. Because as I said, if your arteries are built up with plaque, that's going to also put you at higher risk for hypertension, okay? So why is it important to keep your blood pressure controlled? High blood pressure can have an influence on your entire body, including your eyes, your kidneys, your heart, your brain. All these things can be affected by your blood pressure. Uncontrolled blood pressure can cause heart attacks. They can cause strokes. They can cause you to have congestive heart failure, loss of vision, and memory problems. So all these things, we want to make sure that we are monitoring your blood pressure so that we are not being susceptible to these things. You need to monitor your blood pressure on a regular basis if you have high blood pressure, but you also want to monitor your blood pressure even if you do not have a formal diagnosis of high blood pressure. And I say that because it can make you be more aware if there is a problem occurring. So if you don't have a formal diagnosis of high blood pressure, you don't have to check your blood pressure as frequently as you do if you have a formal diagnosis. But if you go to your doctor on an annual visit, you'll have your blood pressure taken, obviously, when you go to your doctor. And then maybe you should just check it in another 6 months or so, just at home, just to see where your blood pressure is, if it's consistent to where it was when you were at the doctor's visit, just to make sure it's around the same ballpark and then not, elevated. If it is elevated, then you might want to just check it a little more frequently to see if it's staying in that that range where it's a little more elevated. If you have a known diagnosis of high blood pressure, then you want to just make sure that you're monitoring it more frequently to make sure that your medications are working. It's important to keep monitoring your blood pressure with or without a diagnosis of high blood pressure, because blood pressure is what they call the silent killer. And the reason they call blood pressure the silent killer is because oftentimes people are walking around with high blood pressure and have absolutely no idea that they have high blood pressure, because often blood pressure comes with no symptoms. So we want to make sure that we are being diligent with what our blood pressure is, what is a normal blood pressure for us, and what is an abnormal blood pressure for us. So having said that, it is not always the case that people are not having symptoms, but that is a lot of cases where people are not having symptoms. Some people do experience some symptoms with blood pressure, and that can be things such as headaches, shortness of breath, vision problems. Some people even have chest pain and dizziness. Now, me personally, I will let you know that I actually do have a diagnosis of high blood pressure, and I do get symptomatic when my blood pressure is high. If I have a headache, I don't usually have headaches, so if I have a headache, I typically know that I need to check my blood pressure, because if I'm having a headache and I'm not usually under some kind of undue stress or something like that, then I know that my blood pressure is probably running a little high and I need to check my medication or check my blood pressure and maybe talk to my doctor about it. But this is why we want to make sure that we are keeping our blood pressure controlled and monitoring our blood pressure. So what are the stages of hypertension? Stages of hypertension have recently been changed by the ACA. So normal blood pressure is now considered less than 120/80. So it used to be the guideline was 120/80. Now normal blood pressure is less than 120/80. An elevated blood pressure, so not a formal diagnosis of hypertension, but what they call elevated hypertension, or elevated blood pressure, I should say, is 120 to 129, less than 80 on that diastolic number. Okay, so 120 to 129 on that contraction, that top number, less than 80 on that bottom number. Hypertension level number 1 is 130 to 139, and 80 to 89 on the bottom number. Hypertension level number 2 is 140/90. And then the last stage is what they call a hypertensive crisis. And that's anything that's 180 or higher for that systolic number, that top number, over 120 or higher for that bottom number. So I will just touch base quickly on the hypertensive crisis, because you guys have a whole nother workshop completely to its own on the hypertensive crisis. So I don't want to, get into detail on that. But the hypertensive crisis, that is where you may need to go to the hospital. All the other stages, you can probably just talk to your doctor about that. But hypertensive crisis, you may or may not need to go to the hospital, depending on if you're symptomatic with a blood pressure that high. If you notice your blood pressure is that high and you are not symptomatic, call your doctor first. And your doctor might need to just make an adjustment to your medications. If your blood pressure is that high and you're symptomatic, call your doctor and they will most likely tell you that you're going to need to go to the hospital, because you might need some intravenous medications to get your blood pressure down. And the reason why oral medications won't work is because oral medications have to go through the entire digestive system to get that medication down. And when your blood pressure is running that high, it's a crisis situation, and we need to get that medication down, or that blood pressure down, a lot faster. And we need to get that medication into you a lot quicker. So we need to get it right into the vein to get that medication into your system quickly to get that blood pressure down. So that's all I'm going to say about hypertensive crisis. You'll get more detail when you come to the next class. I don't know how many classes away the hypertensive
It's the
crisis
last
is.
one.
It's the last class. So when you get to the last class, they'll talk a little more about that. I know a little bit about that because I think the first year I did the hypertensive crisis. This year, I think Dr. Mirza, who is one of my doctors, is the guy that's doing that class for you. But anyway, moving on, factors that contribute to hypertension. There are factors that we have control over, and there are factors that we do not have control over. So your age is one of those factors, obviously, that we just don't have any control over. As we get older, our blood pressure is just going to increase. That's just how it is. But until 64, it's most common in men, but after 64, it is more likely to be seen in women. So after 65, women are the ones who become diagnosed more frequently with hypertension. Race. High blood pressure is more common among people of African American heritage or African heritage. And unfortunately, they are also diagnosed earlier in age than other heritages. In this race, it is also more common to have serious complications such as strokes, heart attacks, and kidney failures. And then there's your genetics or your family history, which is self-explanatory. You know, if you have a family history, if your mom had it, your dad had it, your grandparents had it, all the way down, then most likely that's going to put you at a higher risk of you having it. Doesn't necessarily mean that you will have it, but it puts you at a higher risk. So as I said, you know, I have hypertension. And when I started this, I told you that I started my career as an exercise physiologist. Now, I've had high blood pressure probably since I think I was diagnosed at about 35. But even in my early 20s, as I said, I was young, so age was on my side. I am African American, so race was not on my side. And my family history, my father has it, my mother has it, my grandparents on both sides of my family have it. So I was fighting all of those things. So even in my early 20s, I did not have a diagnosis of hypertension, but I always had elevated blood pressure. And I told you I was fit then because I was an exercise physiologist. I was working for Aetna in their fitness center, teaching several fitness classes a day, doing personal training, and then going home and teaching classes at the YMCA as well after working out not working out all day, but teaching classes at the gym at Aetna. So those were things that, even though I was doing all these other things, I just couldn't. My genes and my race and all those other things that I couldn't change were still there. But I did not have a diagnosis of hypertension because I was doing all those other things that were helping. So those things that we can change, we need to change so that the things that we can't change, we can kind of combat those things. So moving on, we have weight. That is one of those things that we can have an effect on. We can do something about that. Obviously, the more weight that you have on you, the more blood you need to supply oxygen and nutrients to your body and to your tissues. So as a result, that means you have more blood volume circulating through your blood vessels, causing your blood pressure to increase. So the more blood volume you have, the higher your blood pressure is going to be. Sedentary lifestyle. If you're inactive, if you're a couch potato and you're just sitting there, that's going to cause your heart rate to go up. The higher your heart rate is, the harder your muscles have to work to contract, and the stronger the force of your arteries. A sedentary lifestyle also leads to obesity, which takes us back to the weight. So things that you can change. So making sure that you're staying active. And I'm not saying that, you have to do a Jane Fonda video every day, but you have to be active. You have to, take a walk or, do something a few days a week, 3 to 4 days a week or something like that, just to get yourself moving and being active, which will help to lower your heart rate. It will help to keep the weight off of you, that sort of thing. Smoking, next thing that we can do. Smoking or chewing tobacco can immediately raise your blood pressure, but it's only a temporary raise in the blood pressure. But having said that, it does damage the lining of your artery walls, causing them to narrow and increase your risk of heart disease. So if you have an increased risk of heart disease, that's also going to make you at an increased risk for hypertension. Having a high sodium diets. Too much sodium in your diet can cause your body to retain fluid, which increases your blood pressure. So I don't know how many of you know this, but sodium and fluid, water follows salt. So if you have a whole lot of salt in your diet, then you're going to retain a whole lot of fluids. So that's why a lot of people tell you when you have high blood pressure to stay away from salt, don't have added salt in your diet. That's because if you're adding salt to your diet, or you're not paying attention to the amount of salt that's already in the food, because we all have preserved food now. Everybody's has canned food and frozen foods and all the other kind of stuff that we have in the grocery stores now. If you're not shopping the perimeter of the grocery store, if you're shopping on the inside of the grocery store, there's a whole lot of salt in those foods because they need to preserve the food. So if you're not paying attention to those labels and getting the no salt added or low sodium foods or those sorts of things, then there's a lot of salt in that food. You're going to be retaining a whole lot more water. And what we say about the volume, that's going to give more volume, which is going to get your blood volume up, and that's going to get your blood pressure up. So we want to work on making sure that our sodium level is lower. Also, not having enough potassium in your diet. So potassium can help to counteract the effects of the sodium in your cells. So sodium and potassium kind of balance each other. So if you have enough potassium in your diet, then that's going to counteract the sodium that's in your diet. If you do not eat enough potassium in your cells, or in your body, your cells can build up too much sodium in your blood. And if you have too much sodium in your blood, then you're going to have more water in your body, more blood volume, higher blood pressure. Alcohol, having more than 1 drink a day for women and more than 2 drinks a day for men may affect your blood pressure. And what is a drink considered? 1 drink is equivalent to 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of 80 proof liquor. So stress, number 10. High stress levels can lead to temporary increases in blood pressure. And 11, chronic conditions such as kidney disease, diabetes, and sleep apnea, they all can have an effect on your blood pressure. Uncontrolled blood pressures. Uncontrolled blood pressures can lead to many serious complications. It can lead to a heart attack or a stroke. If your blood pressure is high, it can cause the hardening and the thickening of the arteries, as we discussed before, leading to a heart attack or to a stroke. An aneurysm is the weakening or the bulging of the vessel. If your blood pressure is high, it can lead to that, which can cause an aneurysm. Kidney disease or kidney damage, hypertension can cause weakened vessels in the kidneys and prevent them from working properly. It can cause eye damage. Thickened and narrowed or torn blood vessels in the eyes can lead to vision loss. That's all can happen because of high blood pressure. Memory problems and dementia all can happen from blood pressure. Prevention and self-care. So what can we do to stop these things from happening? So again, there's those things that we cannot affect, like our age and our genetics and our family history. Those sorts of things we can't do, but we can work on the way we eat. Healthy diets, the DASH diet, the dietary approach to stopping hypertension. That's eating high fruits and vegetables, whole grains, lots of dairy, decreasing foods that are high in cholesterol can reduce blood pressure by about 14 points. So trying to stay away from, those dairy products, not necessarily cutting them out of your diet, but, limiting how much cholesterol or dairy foods that you're having. Or portioning, make sure you're sticking to the portion size, which is really what any kind of dieting is about, is sticking with that portion control. It's not saying that you can't have it, but making sure that it's actually the portion that you're supposed to have, actually measuring it out and making sure that it's the correct portion. If you do that, you can decrease your blood pressure by 14 points. Eating foods that are high in potassium, as we talked about earlier with that potassium sodium pump. The more potassium you have in your body, the less sodium you're going to have in your body. So we're not building up on that sodium. So foods that are high in potassium that you want to make sure that you're incorporating into your diet are foods like bananas and apricots, orange juice, tomato juice, tuna, sweet potatoes, cabbage, spinach. Those are all high in potassium. So I want to try to make sure we're incorporating those type of foods into your diet. Staying hydrated, drinking plenty of water is like one of the most affordable and effective ways to control your blood pressure. If you have prolonged dehydration, your vessels can tighten and over time cause the body to retain water. And I will tell you this, if you know you're thirsty, then you're dehydrated. It's already too late. You need to make sure that you're drinking plenty of water. So when you say to yourself, I'm thirsty, you're already dehydrated. So make sure you're drinking plenty of water throughout the day. Getting at least 30 minutes of activity at least 3 days a week, which we've already talked about. And, I'm not going to harp on that, but, I was a physical educator or exercise physiologist in a previous career. So that is really important to me. So you want to make sure that you're staying active. And again, like I said, you don't have to go out there and do those exercise videos and do your spin classes and all that stuff. And I mean, that's great. Absolutely do that if you can. But you need to be active. You need to not be on the couch flipping through the TV and, binge watching Netflix or whatever we do these days, because, that's the society that we live in. But you want to make sure that you're getting outside, you're doing your activity, or, you don't even have to get outside. You're doing something in your room or walking up the stairs on your commercial break. If you want to binge watch TV and there's a commercial break, walk up and down the stairs, or, just do something to get yourself moving and get some kind of activity going, at least 3 days a week. Okay. We can also stop smoking. I'm sure, I'm not a smoker, never smoked, but I'm sure it's easier said than done, but it's not impossible. So that's something that we can work on, reducing the alcohol consumption, and then also maintaining a healthy body weight. So reducing alcohol consumption, empty calories, that'll help to maintain healthy body weight. The exercising also will help to maintain that healthy body weight. Learning to do some kind of stress relieving mechanism. So maybe you want to do yoga. Maybe you want to do some kind of deep breathing technique, some kind of meditation or something like that. And another way that you can reduce stress is by exercise. Exercise is a great way to get rid of, excess stress. And then another thing that you can do is just make sure you're getting a good full 8 hours of quality sleep. All those things will help to prevent hypertension, or things that we can help to do to help prevent hypertension. I don't know what just happened there. What's going on? This thing has a mind of its own.
Need to keep going forward.
Yeah.
Use that one.
Use what one?
You did that one. Yeah. Again.
Okay, there we go. I don't know what happened there. Sorry, guys. Why should you monitor the blood pressure at home? So monitoring your blood pressure at home, as I was mentioning earlier in the presentation, it can help with early diagnosis. So if you don't have a diagnosis of high blood pressure or hypertension, if you're monitoring at home, then you might get an early diagnosis of it, because if your blood pressure at the doctor's office is always 120/80, and then you do one of those readings at home and you find that it's not 120/80 or somewhere in that ballpark, and all of a sudden it's elevated, you want to check it a little more frequently. And if it stays elevated, then you're going to want to call your doctor and let them know that you're noticing that your blood pressure is running higher than it typically has been. And you can come in for an earlier appointment with your doctor and get on the appropriate medications if need be, or whatever the course of action is going to be with you, that you and the doctor come up with, whether it be, working on it without medication, working on it through diet and exercise and that sort of thing, lifestyle changes, what have you, or if medication is the appropriate course for you, whatever the choice is that you and the doctor decide is going to be appropriate for you. But early diagnosis is one reason why we really would like people to monitor their blood pressures at home. It can help track your treatments, helps to determine if the medication you're taking and the lifestyle and diet changes you are making are helping you. It can encourage better control. It gives you a stronger sense of responsibility of your own health. It can help cut your healthcare costs because if you're monitoring your numbers at home and you notice that there's a different kind of trend in your blood pressure readings, if your blood pressures are normally, whatever on, valsartan 160 milligrams, and all of a sudden it's, up here, maybe valsartan 160 milligrams is not cutting it for you anymore, and you need a different medication. You need to bump up in that medication, or you need to add an additional medication, or something else is going on. Or maybe you're on valsartan 160 milligrams and you've lost 10 pounds, and all of a sudden you're noticing that your blood pressures are now down here, and maybe you need to be on a different dose of medication, a lower dose. So if you're monitoring these blood pressures at home, we can keep track and we can see, and then you don't necessarily have to come in to see the doctor. You can call the doctor's office and just say, hey, this is where my blood pressure is, this is the trend, this is what's going on. And the doctor can make an adjustment to your medication and say, okay, let's try this for 3 weeks or 4 weeks or whatever, and see what happens, keep track, and then call us back and we'll see what's going on. That way you don't have to come in, you don't have to pay that copay, your insurance doesn't have to pay anything. And so it'll save you some money and your insurance some money. So that's why we want to monitor our blood pressure at home. And then check if your blood pressure differs outside of the doctor's office. So I can't tell you how many times I bring a patient into the room and the first thing they say to me is, it's going to be high. It's always high at the doctor's office. It's always higher at the doctor's office. And so if you're monitoring at home, we'll know if you have what they call white coat syndrome, because a lot of people, when they come in, they're just automatically just nervous about being at the doctor's office. And so their blood pressure, I'll take it in, I'll get 140 over, 82. But when they come home, or they come in with their blood pressure readings from home, their blood pressure readings from home will show that on average, their blood pressure is 130 over 82. So we know that this reading that I'm getting is not really indicative of where they're really at. So that way we know that as well. So let's talk about types of home monitors. Okay, so types of home monitors. We have different types of monitors. There's the manual, the old school cuff, which is what you usually see in the doctor's office. It's not usually what we recommend for you to use at home. It can be used at home, but we don't necessarily recommend use of that at home. Reason being is because it's, well, first of all, most people don't know how to use it. A lot of people will come in and say, how do you read that thing? And then I have to explain to them how to do it. It's a matter of looking and hearing and listening at the same time. But you put the cuff on and you have to pump it up, and you've got to have the stethoscope. And when you're one person doing it by yourself, it's a little complicated to do that at home. So unless you have somebody who's at home with you who can do that or do it for you, or and knows how to do it, then we don't necessarily recommend that you get a manual cuff to take at home, to take a home blood pressure reading. Manual cuffs probably are the best for blood pressure readings, but again, it's really hard to take a blood pressure reading with a manual cuff by yourself. So not recommended for home use. The automatic cuff is what we really do recommend for people to use when they're at home. It inflates on its own. It releases air to measure blood pressure. Some machines have several settings so that you can take more than one person's reading, and you can store the readings on the machine. There are some machines that take more than one reading at once and then give you an average of the reading. It's really just a matter of what you want on the machine. It's generally recommended that you use an automatic machine that goes over your arm, rather on your wrist or on your finger cuff, which on your fingertip. And actually, before I started doing this presentation, I didn't even know they made one that went on your finger, but apparently they do. I can't imagine that that is very accurate. The wrist ones are not as accurate either as the arm one. So if you're going to get one, we recommend that you get one that, like this here, that actually goes on the arm, okay? So when you're picking a monitor, as I said, there are several different types of monitors. We recommend that you want to get a monitor that's going to fit into your lifestyle and your budgets. There's all sorts of different monitors that do all sorts of different things. They have all different bells and whistles. So you want to make sure that you are getting one that's not going to make or break you. It's going to be efficient for you. You need all those bells and whistles. You don't need all those bells and whistles. As long as it takes your blood pressure, that's really all that you need. If you want all those bells and whistles and all those features, that's great, but you definitely don't need them. When you're getting a blood pressure monitor, you want to make sure that it's going to have a display on it that you can actually see the display and see the numbers that are on there. You don't want a screen that's going to be really little and then you can't see the numbers. So you want to make sure that you have a display on it that you can clearly see and clearly read. Before buying the machine, you should check the validity of the machine. Most of the machines don't have a whole lot of information on the validity. The Omron, which is what this machine is, O-M-R-O-N, Omron, that is the machine that has most of the information that I have been able to find on the validity and the testing of it. And validity is just how valid the readings are. So how much testing they did to see how valid and accurate the readings are. And so for that reason, at our practice, that's what we normally recommend people get. Did you have to get an Omron? No, you don't have to. But they have the most research out about what they do for the validity of their machines. So you can, by all means, get a CVS brand or, you know, the Walmart or Target or whatever store you happen to be in. Everyone has blood pressure machines. You can certainly get one of their brands, but for validity reasons, this one has the most information about the testing that they do to make sure that the machine is valid. And then the other types of machines that are out there are the public blood pressure machines. Everybody's have seen them, you know, at the Walmart, at CVS, at Costco, wherever. You walk in and they have the little machine where you sit down and you put your arm in the little cuff and then it takes your blood pressure. They can be helpful, but they do have their limitations because, you know, we don't know if the cuff size is correct. I mean, everybody's arms are different. Some people have really tiny arms, and so the cuff is not going to be appropriate for them because their arm is so little. Some people have really large arms, and then the cuff is not appropriate for them because the cuff is going to be too tight. We want to make sure that the individual who's using the machine actually knows what they're doing. Perhaps they're not using the machine correctly, so you're not getting a proper reading. And then how do we know that the machine is valid, that it's calibrated and giving us an accurate reading? So it's helpful, but they do have their limitations. If that's all you have, then that's all you have. But they have limits to what they can do. So now that we've talked about blood pressures and the different types of machines that they have out there, we want to talk about how to take an accurate blood pressure measurement. How to take an accurate blood pressure measurement. So first thing we want to talk about is you do not want to take your blood pressure measurements as soon as you wake up. I know most people are like, that's the best time to take your blood pressure because I've been sleeping all night, my blood pressure is low, I'm relaxed, it's time to take my blood pressure. You're right, your blood pressure is at its lowest when you're asleep. But when you first wake up, that's when it's at its highest. So you should not take your blood pressure as soon as you wake up. You should wake up, move around and do a little stuff before you decide to take your blood pressure. However, what you should not do before you take your blood pressure is you should not eat before you take your blood pressure. And if you exercise in the morning, you should not exercise before you take your blood pressure in the morning. And if you have medications, if you take medications, you should not take your medications before you exercise in the morning, okay? So when you wake up, move around, do some things around the house, put some laundry in, do whatever you need to do, but don't eat, don't take your medicine, and don't exercise right away, okay? You want to make sure you also don't have your first cup of coffee before you take your blood pressure, okay? You should avoid caffeine for at least 30 minutes before you take your blood pressure. When you are ready to take your blood pressure, you want to make sure that you go to the bathroom and empty your bladder, because if you have a full bladder, when you take your blood pressure, it can increase your blood pressure anywhere between 5 to 10 points. So if you don't empty your bladder before you take your blood pressure, then your blood pressure may actually be elevated. When you're ready to take your blood pressure, after having moved around all day, and you're like, that doesn't make sense because now my blood pressure is going to be higher because I've been moving around, sit quietly for 5 minutes in a quiet room, okay? And just sit there and relax for 5 minutes before you take your blood pressure. After having done all of that stuff, after having emptied your bladder, just sit quietly for 5 minutes before you take your blood pressure. When you're ready to take your blood pressure, we want to sit in a chair that has a nice support on the back, and you want to sit with your feet flat on the floor. So sit with your feet flat on the floor, have your back supported by a chair, okay? And you're going to sit with your legs uncrossed and your arm up on the chair at chest level, at heart level, okay? So if you're at your kitchen table, it's probably the ideal place to do it, because just like I'm sitting right here, you can see that my arm is right at my chest level. So that is perfect. So I'm just going to sit here for 5 minutes and relax before I take my blood pressure. Okay. Then we want to make sure that we put the cuff. Let's take the cuff here. We open the cuff up. This little thing here. Some of them actually have a little thing where it says artery here, but this should go exactly where your artery is, right in the middle of your elbow. You want to make sure that you have a bare arm. You're going to pull it, flip it around. If I can get it to, oh, there we go. Flip it around, there we go. Then relax it. That should be lined up right where my artery is. You can see that vein right there. And that's where this tube should come right down the middle of my arm, okay? When you're taking your blood pressure. Okay. You want to make sure, like I said, you put the blood pressure cuff on your bare arm and not over your clothing. You also don't want to, if you have a tight shirt, roll that shirt up and just put it on the bare arm, because if this is constricting up here, you're going to constrict that blood flow and it's going to raise your blood pressure. So, you'll notice when you go into the doctor, most times, not all the time, but most times they should tell you to pull your shirt up if it's loose. If it's not loose, they'll have you take your arm out your shirt or something like that. They don't always do that, but that's the way it should be. If your shirt's thin enough, sometimes they'll have you do it over the shirt, but it should be on a bare arm. Let's see, where else? Last thing you want to do is make sure that you take 1 to 3 or one reading every 3 minutes, in 3 minutes after your first reading, so that you can get the average of the two and make sure that they're about the same. And the last thing that I want to tell you is, when you're taking your blood pressures, when you're monitoring your blood pressures, you want to make sure that you are only taking your blood pressures no more than 2 times a day. Nothing is worse than when a patient comes in with 8 pages of blood pressure readings in 1 week because they're taking their blood pressures over and over again. First of all, you got to give your brachial artery a break. Okay, the poor little thing, you're wearing it out if you're taking your blood pressure that much. The other thing is we talked about stress. If your blood pressure is high on one of the readings and then you keep taking your blood pressure, you're stressing yourself out and your blood pressure is just going to keep going up. So relax, don't keep taking your blood pressure over and over again, okay? Twice a day, what you should do. Morning, once in the morning, once in the evening. Your blood pressure is transient. It is going to go up and down depending on what's going on in the day. We talked about all those things that can affect your blood pressure. So one high blood pressure in the day is not going to make or break you. It's when you have consecutive blood pressures that are elevated over a certain amount of time is when we start to become more concerned about those high blood pressures. So again, when you're taking your blood pressures, monitoring your blood pressures at home, doing it accurately. We want to make sure that we're not taking the blood pressure first thing when we wake up in the morning. We want to wait a few minutes before we take our blood pressure, move around the house a little bit. We want to make sure that we don't eat. We want to make sure that we don't exercise. We want to make sure that we don't drink caffeine. And we want to make sure that we empty our bladder before we take our blood pressure. When we're ready to take our blood pressure, we're going to sit down in a nice chair that has a back on it so that it's supporting our back. We're going to put our feet firmly on the floor, have our arm elevated on a chair or something that's going to keep it at chest level, at heart level. We're going to put the device on our arm with the cord coming out right at our elbow level, right here. Sit for 5 minutes. When we're ready, press the button. Most of them, they come separate like this. You just plug in the arm piece and it's ready to go once to make sure the batteries are in, of course. And then you just press that start button and it'll pump up. And then once it gets to the level it needs to, it's going to let the air out and then it'll give you a number. Most of these have 3 numbers on it. And it actually tells you, most of them tell you right here. So it has SYS for the systolic, which is the top number. Remember, we talked about that. That's when the heart contracts and pumps the blood through the body. The diastolic will tell you here, that's when the heart is relaxing and filling back up with blood. And then the 3rd number down here, that'll be your heart rate, your pulse, okay? And then I believe this one will tell you what range your blood pressure is, if it's normal, if it's hypertension, that sort of thing. And then some of the machines may or may not tell you if your heart rate is regular or irregular. But again, those are part of those features that all of the machines may or may not have, and you just need to decide what features work best for you. So that, I think, concludes the presentation. So we will open it up for questions and answers.
So just a couple quick reminders. Paul and I talked a little bit before the workshop started because there were some good questions last week in terms of the brand of monitoring that should be used and whether or not they need to be calibrated.
Oh, yes, I did forget to mention the calibration.
Oh, that's okay.
Yeah.
So
the calibration. So there really is no way to calibrate the machines. I mean, even in the doctor's office, when our machines are done, when we notice that they're not accurate anymore, we throw them out and get a new one. So there really is no way to calibrate the machine. But for these, what you can do, and what I suggest, we suggest most of our patients do, is bring your machine into the doctor's office and have it tested against the manual machine at the doctor's office. So if you bring it into the doctor's office and you get a reading with the manual machine at the doctor's office of 120/80, and then you take your machine and your machine says 130/70, then you know your machine's about 10 points off. So that's one way of kind of knowing where your machine is, the accuracy of your machine.
good. And one of the things that we have here, and we can get to you, is a place to record your blood pressures. So you can put in the date, the time, your blood pressure, and your heart rate or pulse, and then bring this to the doctor's office. So it has a nice record of what you've been doing at home. So we do have those available at Town Hall. I did distribute those to primary care offices in town. And if you haven't been able to get one and you need one, please give me a call and we can get one sent to you. All right. And in addition to that, I want to remind you that we do have these self-monitoring devices here if you've been unable to obtain one through insurance or through any other purchase. I have them available here at no cost and can certainly get that to you. So again, another reminder that we have them available. All right, I think that's it for the presentation. We can stop the recording and then we will